Hello, everyone, and welcome to what promises to be yet another engaging discussion in our complimentary CHW webinar series. Today, we are going to be learning about and discussing stress and anxiety management with Dr. Audrey Sasson. My name is Barb Rosenstein, CHW National Vice President, and I'm honored to bring greetings on behalf of our National President, Toba Train, and CHW CEO Lisa Colt-Kotler, who you will meet shortly. We have over 200 people registered today, folks, so clearly learning ways to feel calmer and handle everyday pressure is needed and very valued. So we're really looking forward to this session. I would also like to extend a big welcome, of course, to our guest speaker, Dr. Audrey Sasson. Dr. Sasson is a naturopathic doctor and professional leader. With over 18 years of clinical experience, Dr. Sasson brings a depth of practice-based insight to her leadership and advocacy work, having completed her naturopathic medical training at the Canadian College of Naturopathic Medicine in Toronto. In clinical practice, Dr. Sasson delivers diet and lifestyle solutions related to digestive and hormonal health, immune support, and the management of chronic and preventative disease. Her approach emphasizes education, collaboration, precision medicine that empowers patients to take an active role in their health. Dr. Sasson currently serves as chair of the board of directors of the Ontario Association of Naturopathic Doctors, providing governance leadership for the provincial organization representing naturopathic doctors across Ontario. So before I hand the mic over to Audrey, I want to remind you that if you have questions during the presentation, just submit them to the Q&A button. And over to you, Audrey.
Thank you kindly, Barb, for that introduction. Welcome, everyone. It's my true pleasure to be here. I'm going to just share my screen so we can follow along. Just want to ensure that all of you can see that clearly. Wonderful. So I'm here today to talk about anxiety and stress from a naturopathic lens, and also to layer in a Jewish perspective on what that means to us when we are experiencing stress. We currently live in a society where there's constant inputs of urgency, whether that's notifications or responsibilities, the news, family affairs. It's constantly nagging at us that we need to act. But what I want to hold with you today is an opportunity to retrain the urgency and understand that you are really in control of all of these things. Because over time, this chronic demand can lead to multiple systematic effects that we will explore today. The focus today is about alignment. It is about retaining the energy that you need and really selecting where you want to choose for your energy to go. Of course, as a naturopathic doctor, I'm going to be providing some of my lens on what's going on, but I'm not here to make those diagnoses. So it's not intended to replace your own medical doctor's advice. And if you do have any questions, I'm happy to entertain them at the end, or you can connect with me later. But this is more for informational purposes, of course. And if you have any questions, seek the help of a regulated healthcare provider. So now that we are understanding of the urgency, and what I really want to bring home today is that there are tools that you can utilize on the daily to help support better utilization of how you channel that energy. Just thinking about where you are right now. How are you sitting in your chair? Are your shoulders right up by your ears? Can you relax? Can you take that deep breath and just sit comfortably? Is your jaw clenched? Really take a small pause and assess how you're sitting. What's going through your mind? Are there anything that you just got off a call with someone and that's lingering in your thoughts? I really want you to engage in presence and understand how you can actually retrain your brain. So while I titled this The Architecture of Calm, it really is building foundational efforts to help your body navigate challenges and stress. And what I really want to make the differentiation is of what is stress and what is anxiety. We use that word interchangeably. I have patients that come in, women are saying, oh, I'm so anxious and I'm so stressed. Stress is not a bad thing. It's okay to be stressed. It often fuels motivation and forces you to do things that are otherwise maybe a little bit out of your comfort zone, but it's fleeting. It's situational. And often you restore yourself into a normal regulated framework. The challenge happens when that stress response is elevated over a longer period of time, which lends itself to being more anxious. Often doesn't really have a trigger. Waking up in the morning with gripping anxiety, going through the motions when you know what to expect, but your body is situationally positioned to anticipate this fear. And a lot of the time, the anxiety is actually positioned around future focused. So the what ifs, the focus on the worrying. What if this were to happen? And understanding that all these hypothetical scenarios are manufactured. The challenge is that the body doesn't understand the difference between the perception of stress and actual stress. So while you're playing scenarios in your head, your body's actually fueling the same active response, whether that is shortness of breath, muscle tension, difficulty sleeping, a little bit of irritability, tapping your knee up and down, waking up constantly, or even in a state of metabolic dysfunction. This prolonged stress state leads to anxiety. And typically when patients are coming in, they're naming any one of these things. But at the root of all of this is the anxiety or the unmanaged stress. And so what's really driving this? Because we have really two major responses in the body. The nervous system is positioned, and I'm sure you all heard of this fight or flight. I'm being chased by the bear. I got to protect myself. This is what I need to do. This is what's urgent. And it's also to the opposite end of that spectrum is this parasympathetic tone, this rest and digest form. This is this yoga, more grounded behaviors. These behaviors should occur when you're eating, when you're sleeping, and when you really are focused on being present. The challenge is that because of this societal demand of urgency, we're finding ourselves living predominantly in this sympathetic tone, where your body is sympathizing behaviors, namely causing you to act under stress, heart palpitations, worrying. And a major piece here is that it causes digestive dysfunction. And so whether that is an output, constipation, whether that is in food sensitivities or gas or bloating, when the body's positioned in a stressed state, it is not looking to heal or support growth because it's focused on survival. And what I want from all of you today is to understand that this position of this survival mode is not sustainable. And we need to move ourselves consciously into being aware of what is affecting us and what's making us feel that we have to do things right now, when really we want to be in some level of control of this. And so this is the most important piece here is that, I put the image here of an email. How many of us see an email before we even open it and we're like, oh, I know what this is going to say. And we're already starting to catastrophize what's going to happen. We haven't opened it. We're responsible for when we want to open it. And we're really, it can't be that threatening. You're not being chased by a bear. There's no car coming at you. And yet your body's producing the same response. Over time, this hypersensitivity response to stress can also lead to that chronicity. So you don't have to physically be hunting and feeling like you're being chased. The daily actions that you experience, and maybe now a lot of us are becoming numb to it, but I want to bring you back into the presence of it, is that the consequences of the urgency of anxiety leads to this chronic fatigue, fight or flight, sympathetic tone. And so that restlessness, that cortisol spike, the adrenals that go up and down, that really manifests for us in many, many different ways. And I'll get into that a little bit more. The cost of chronic stress is really decision fatigue. How many times have you come to your kitchen and said, okay, I don't know what's for dinner, or feeling very frustrated when they're going to the supermarket, or having to respond to 7 different things. I have an event here, and what do? We just ignore, or we freeze. So while this fight or flight is a very notable situation, there's also the overextension piece, is when you just freeze, where you're just exhausted from this chronic stress. And what does that lead to? Mental fogginess, inability to focus, concentrate. And so what do? You don't want to engage. You don't want to do social engagements. You really want to stop connecting, and you become recluse. You're sitting at the dinner table, but are you really present? You're present physically, but are you mentally present? Or, doing tasks or recalling things that otherwise would have been so familiar to you are now becoming things that you need to jog your memory for. And of course, the disease can occur from this, or the chronicity of disease, because like I said, healing cannot happen in a state of stress or survival. Your body is not focused on deep-rooted healing. How many times did you fall or know of an injury, and when otherwise, you would have naturally healed quicker or sustained better regulation, it's somewhat like lingering longer. And so these are the things I'm hearing in practice. Oh, like Dr. Sasson, I can't recall anything. I'm doing something, and all these words and all these names and all these numbers that were coming to me so easily are now lost on me. And I just feel exhausted. And that burnout really happens with the chronicity. So it doesn't just make you feel bad when you're stressed, it physically alters your cognitive process. And then, of course, being a naturopath with a strong passion in women's health, I'm seeing this more in the metabolic dysfunction. Caloric restrictive diet, got a personal trainer, working out, and yet they come and tell me, well, if I did this, 3 years ago, I would have lost my 10 pounds, and I can barely get a pound off, and I'm doing all these things, and I'm focused, and I'm being diligent, and I'm not cheating. And yes, of course, depending on when you're speaking to a patient, if they're perimenopause or postmenopause, there's going to be a hormonal influence. But that metabolic dysfunction, weight loss, toning, that is not a key survival tactic. So why would the body waste energy on caloric expenditure when it thinks that it needs the calories to survive? Because we all know that a fight or flight situation is positioning us as survival. Do we want to get rid of calories? No. Do we know when our next meal is coming? No. Your body doesn't know that you're living in modern day society where food is in excess. What it's understanding is, whoa, there's lots of stress here. I can't afford to burn calories right now. And so the root of all this is regulating the stress response. How many times do we go on vacation? And I hear this all the time in practice. I went on vacation and I was eating this and I was eating that, and I was eating carbs and I was eating desserts, and I even had a glass of wine, and I came back and I was the same weight. And time and time again, or I go to this country and when I eat this particular food, I feel okay. And when I'm at home, it doesn't feel the same way. Well, how do you feel when you're at home versus how do you feel when you're on vacation? How do you feel when you're in charge of your own selections versus you have to do everything plus the preparation for dinner? Of course, when you reduce that stress response, the body can now shift focus on the healing and the things that are supposed to happen. And what I really want to drive home is that calm is a practice. It's not a passive state. You're not either stressed or you're calm. And we all know this because we're women and we work hard. And it's not that we're go, 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 and then we're passive. To be calm is an active state. It's not the absence of stress, and it's not a personality trait. It is a presence of regulation. It's intentional. And it's often understood to be something passive. Well, I'm not freaking out about this, so now I'm okay. No, you haven't bridged over into that calmative state where the nervous system is actually shifting, that there is no threat, there's no imbalance. This is a trained behavior, and it's trained because the brain is adaptable. And this is a fancy word, neuroplasticity, but I'm here to educate, because naturopathic doctors, what we do is education. And I educate all my patients, because if I told them to do something and they didn't understand why, they're not going to do it, right? And so here I am to tell you that neuroplasticity is the reason that the nervous system isn't fixed. It's adaptable. The brain adapts to repeated experiences. So if you do something and every time the expectation is the same, you're going to be bound to experience the same thing. And yet, if you do something with the intention that it's going to be better, or you train your brain to explore different pathways, then you're much more able to re-establish good, healthy neural pathways. And the rewiring can happen at any age. This is not something like, young children, they learn a skill, or they're in school and they can learn another language. This can happen at any age. It's never late to retrain neural circuits. And this middle image of this kind of path is one to say that, of course, if you're hiking a trail and the footsteps are already there, and that's the one you always do because that's the easy route that you know, then of course that's going to be the one your brain's naturally going to want to flow to. If that's the worry path, if that's the anxious path, that's the path of least resistance, because you've trained your brain that that's comfortable and true. And what I'm challenging you today is to take a different path or a different road, or suggest to yourselves that maybe gradual exposure and doing different lifestyle modifications can actually retrain the brain to explore different paths, create different neural circuits. And so one of the ways we do that is really targeting the vagus nerve. This is a nerve that comes from the brain all the way down to the digestive tract. And this is a nerve that is responsible for regulation. It's like this superhighway that connects to all the organs. And when we can target the vagus nerve, we can influence our heart, circulation. We can influence the lungs, the breath, and we can influence our gut. How many times do you eat things when you're in stress? Does that get digested well? Probably not. Probably gas and bloating and feeling uncomfortable. Well, if you ate something when you're in a more comfortable state, granted there's no food sensitivities, you're more likely to experience the food, absorb the food, and digest the food much better. And so this speaks to the parasympathetic tone. So this vagus nerve, reminding you from a few slides back, is responsible for this rest and digest. It shows the body that it's safe. And the form of, one of the easiest forms to stimulate your vagus nerve is actually to do some breath work. So I'm going to invite you all to sit comfortably in your chair. Place both feet on the ground. And if you can, and if it's comfortable, sit back into your chair. And if you feel inclined to, you may put your hands over your abdomen. And I'm going to teach you the skill of box breathing. And the most important thing about box breathing is the exhalation is held longer than the inhalation. So this visual will really help us understand where and how I'd like the breath to happen. So a nice deep inhale through the nose, 2, 3, 4, and then a longer exhale. 1, 2, 3, 4, 5, 6. And inhale yet again. And you may close your eyes if you feel like that's more comfortable for you, but really noticing, your jaw, loosen your jaw, relax your chest, lower your shoulders, and keep with that breath pattern. A few more breaths for all of you. And just bringing yourself into that presence and allowing you to understand that the structure of breath is actually sending a positive signal to the vagus nerve. As you exhale long, you're stimulating the parasympathetic tone. You're actually lowering your heart rate. And the brain is receiving the message that it is now safe. Have you noticed any changes? And this is something you can adapt and do anytime, multiple times a day. before bed, before a meeting, before any notable activity that is often, found to cause you some level of stress. It's an effective way to help reduce it, and you can repeat it for at least 1 to 2 minutes per day. And the concept of doing these, breath work, and I'm going to talk about a lot of different things, is that it's not a one-off. As we know, when we want to see changes, we need consistency. But one breath to calm the brain or one perfect week is not going to make the impact. Intensity may feel productive. You're doing very well for a short period of time, but then as soon as you release the brakes, everything comes back to normal. It's the consistency, the small daily habits that make for a powerful and impactful change. So how does that even look? Does that look like making a big list and keep adding to it and just chipping away? Does that look like really prioritizing tasks and noticing what really requires urgency and what doesn't? All of these little things and breaking down larger projects into smaller ones also helps channel another neural pathway, which is dopamine, a reward center. So both intensity and consistency signal the reward. You feel great when you accomplish a certain task, whether that was your whole entire purpose for one solid week of doing something so you can achieve a goal, or if it was more habitual and part of a longer process. Both of them meet at the reward center. Both of them release the dopamine, making you feel good, increasing the motivation, and making you feel accomplished. The difference is that one is sustainable and one isn't. You can't replace daily activity, good proper nutrition, good healthy mindset with 1 week at a fancy spa where all you did was listen to the instruction only to come home and repeat your normal patterns. 1 month of a solid diet, 1 weekend or month away, that is not going to do it. We know that consistency is the key to change, no matter how small it is. If it's followed with discipline, the ultimate goal will be achieved and the longevity of that change will also be sustained. And here's where I love to, lean into our Jewish faith and really talk about the ultimate reset. So now that we know that how important the parasympathetic tone really is, what's more important to understand is that we've been built into that. And really Shabbat is our opportunity to reset. It is a time of reflection, of gratitude, of meaningful conversations. Reflect on your Shabbat table. Who comes there? Are you a guest? Are you a host? Yes, of course, we always stress about, is there enough food on the table? And last minute, we're kind of, at least in my house, I always feel like I don't make enough. And so I'm adding another dish at the end only to find out that I've made too much. But that's besides the point. The point here is that it's an opportunity to reflect, to shut off the signaling of urgency, to reinforce the sense of belonging and identity, because community really here is key. Being part of a faith, being part of a religion that knows miracles, that knows about the feedback of community, and even part of Hadassah, all of your wonderful events that come together where you see each other. This is so impactful on restoring good, healthy, parasympathetic, rest and digesting tones, where you're feeling connected. But in terms of that connection to family, that has that layered in effect. So thinking about even your, last Friday and now maybe positioning this Friday, I want to really invite you all. You don't have to keep Shabbat. I'm not a Rebbitzin, but I want to just offer you the opportunity to really be present in that moment, whether it is a reflection piece, whether it's an extra long hug, whether that's a meaningful conversation. Be present and be aware and allow your body to slow down. You get a weekly opportunity to just relax. And so now that we know what the body needs and how it impacts it, I'm going to walk you through a few ways in which we can get this done. So now you understand the urgency, you understand the chemistry and the science and the biology. And now we need to ensure that it gets implemented. And like I said, 1 weekend away at a spa is not going to do it. This is going to take daily conscious effort. And you can't really I wrote it here as you can't think your way out of stress. And that's true. I mean, in a stressful moment, if I tell you now, well, you know what? Now you're going to stop and you're just going to breathe and all will be okay. That's not going to happen. You're going to need multiple inputs to make this to work. And the longevity of change is going to require some level of physical involvement. And so physical activity on the daily is where I recommend all my patients, where I used to recommend 3 to 4 times a week at 40 minutes. Now, if it's just 15 minutes of daily movement, that is sufficient as well. Whether that is mind-body practice, walking, breathing through yoga, or Pilates that involves a stretch. Just because you're feeling anxious doesn't mean you don't have an opportunity to work it through with movement. And while I have patients who say, well, you know, I'm too anxious, so I really can't do stretching and lie on a mat. I need some high intensity training. I need a boxing class or a spinning class. In fact, that would be much worse because your cortisol level is already elevated in a state of stress. And what have you done with a high aerobic intensity training? You've now mounted a harder response. So now the cortisol, which is meant to be a stress response, which we need in certain parts of the day, is in such a high threshold, and you've now compounded that with extra intensity that you've now foregone and actually increased your sympathetic tone even more. And the other piece here is that it can also affect your sleep. So good quality sleep. And I use the word here restorative on purpose. When I first started practice, like 18 years ago, I used to ask my patients at every intake, you know, your family history, your medical history, your diet, what is your output like in bowel movements, what are your social engagements like, do you feel supported? And of course, I'm going to ask about sleep, an integral part to our biology and our health. And I used to quantify it. She slept 7 hours. She slept 5 hours. Guess what? Sleeping 8 hours interrupted is worse than sleeping 5 hours solid. So it's not the length or the duration of the sleep, it's the quality and depth. I have a lot of patients with difficulty falling asleep or difficulty staying asleep. These are things that are going to challenge the sympathetic tone because we know that the nighttime is where things are restored and repaired. And so that's a target area that I usually address with my patients as well. Blood sugar. So caffeine, stimulant beverages, alcohol, quick acting carbohydrates, all of these things are also going to augment your blood sugar. And these spikes are also sympathetically compromising. And so we want to make sure that we're not eating in this kind of haphazard way and that there's more sustainability for blood sugar as one element to introduce more of this calming parasympathetic tone. Acupuncture is a discipline I do as a modality in the clinic as well. Some women love it as a great physical way to just restore, ground, and balance your chi and your meridians. Morning light exposure. So this is something that is very important. I live in Toronto. We haven't had a lot of early morning light, but it is important to just look out. You know, you're in an office building or you're working in a clinic or your home. Please look out. Try to get some sunlight. Really focus on getting that sun rays on your face. In some cases, if you can just take those few big, deep breaths outside, that would also be very helpful. But it's not so much about getting it, it's about getting it early in the morning and really kind of igniting the brain. The melatonin was up all night and now we woke up ready to go. But what do? It's dark. So do we open the light? And then we start thinking, okay, I don't want to turn on the lights. I'll just snooze a little bit longer. I know what's good. I'll reach for my phone and I'll start scrolling on the blue light, as all of us do. So please don't, and I have a slide dedicated to why I don't want you to do that. And the other one is cold exposure. So, of course, I'm sure all of you know about the big fad of the cold immersion and getting into a cold water bath. Many of us don't feel inclined to do that. So, an alternative is really just to put water on your face, cold water on your face. You can fill a bowl with ice and dip your face in the water. You can put a cold towel really in that water bath and then place it on the face. That helps with inflammation. It helps stimulate moods and also helps with circulation. So a great way to feel grounded and feeling present. Another one that is quite important and maybe not one that is often talked about is really that connection with the earth. So it's called grounding. Typically, I have patients who have access to just walk barefoot. Children, they love walking barefoot. Often we look at children and where do they love to do? They love playing with the earth, and that's a very grounding. If you have access to a beach and you do your walk, I encourage you to do it barefoot. And the other one is really humming, singing, and gurgling. And I've really put that actually together because all of these three are researched to stimulate the vagal tone. And remind you that the vagal tone is one that is responsible for that safety parasympathetic. So the vagal branches just around the throat are very helpful to, or when stimulated, are very helpful to subdue that stress response. And we all know that, singing a song that we really like gets us in a great mood. People who hum, sometimes even after you brush your teeth, you do that gurgle and you start stimulating. So vagal tone can really be quickly switched with some of these ideas that I've shared with you on this slide. And so now that you understand that there's a rhythm to where the body can really lean into, we understand that there's a weekly rhythm through Shabbat, and maybe there's daily rhythms that I would encourage you to do through lifestyle. If you really ask me, what are the two most important times of the day to really set those book endings of the day, it would be morning and right before bed. So those really would be the most influential times, setting the tone and then closing it down. So really how we start our days is very important. And so I'm just going to, offer this suggestion that we don't check our phone first thing in the morning. Because what are we really doing but really responding to other people's urgency? There is no reason to lean over on your bedside table and just the first thing you do is start scrolling either news or your emails or your notifications. I want you to wake up, if you can, and show some gratitude, whether it is through the Modani prayer that you say as a point of reflection, which is suggested to be said while still in bed, or really setting the tone and affirming the day through gentle gratitude. I've woken up. I'm feeling so-and-so. Today is going to be a great day. Today I'm going to accomplish as best as I can. I'm going to choose me first. And that intentional practice, at least initially, may sound a little bit out of sorts, but eventually what your mind hears is what it actually manifests. And so positive affirmations is a wonderful way to start the day, but showing gratitude is an even more important piece because gratitude trumps fear. And when there's fear, there is worry, and there's worry, there's anxiety, and there's anxiety, there's stress. And so if we position ourselves in the morning with gratitude, we already kind of relieve ourselves from that feelings of fear. Of course, if it's followed by gentle movement and good deep breath work, that is a great way to start the day. And then again, you're invited to check your phone. But those 10 minutes in the morning are crucial, ones that you can easily do, and ones I encourage you to do as a little trial for yourselves. And conversely, the evening, that's when we kind of undo our day, looking at or reflecting on what we've done, hopefully in a very positive lens. That requires a cool, dark room. It requires you to have a break from your screens and maybe encourage you to say Shema, a prayer that really allows you to reflect, officially hand off the worry back, and signals to your brain that it's safe to power down. It's a ritual of closure. Over time, as we talked about with neuroplasticity, the body starts thinking, okay, Shema means I'm okay, I can wind down. Modani means I can start my day. And this repetition of pattern is not the normal pattern. The normal pattern might be checking my phone and then scrolling until I fall asleep, or reading the news or falling asleep with the TV on. All of these behaviors that may not be as conducive to your current situation, allowing yourself to be more introspective, more reflective, and more present is going to have very, very meaningful impact on your sleep and on the functioning of your day. So I invite you to do that too. So of course, everyone's very curious, I would think, about, okay, so now I know what to do in terms of the mindset, in terms of the movement, but are there nutrients that are helpful for me to consider? And so, yes, there are, and they can come in many different forms, whether they're herbal, whether they come in like a tea or a supplement, whether they come as a food. Magnesium is one that is highly deficient in most women. And so one that is very, very calming to the nervous system, very helpful, dark leafy greens, nuts and seeds, and also, of course, in supplement form. B complex, of course, that trigger more of that relaxation in the nervous system too. I'm sure many of you know of a B complex. Certain B vitamins have more of an adaptive nature. For example, B6 will help you adapt more to stress versus the complex itself, which is more of encompassing of all of them. And then, of course, omega-3 for brain health. So those of who were pregnant may recall that in your third trimester, you take some DHA for cognitive development, which is a branch off of your omega-3, which is split into EPA and DHA. Very calming for the nervous system. L-theanine, one that I often recommend, which happens to be a component found in teas. And the beauty of this is that it helps promote relaxation without the sedation. And that's a nuance when you talk about natural therapies, is you don't really want to shut down, because you want to be able to function and think clearly and do the tasks at hand, but not to be as sedated and removed from what's going on. Ashwagandha is popular now, that's trending, I can say, but it's long rooted in adaptive formula. Lavender is well studied in calming the nervous system, and rhodiola as one that helps with the adaptive form. Passion flower, chamomile, and mushrooms are coming up to more of a standard. There's certain ones, obviously, that help with neuroinflammation and cognition, like lion's mane versus maybe cordyceps and reishi, which is more for calming the body. And vitamin D, I think everyone is no stranger to that. If you haven't seen the sun in a long time, or you're not able to go outside, you'd be low in vitamin D, the sunlight vitamin. So obviously, what does that do to your mood? You feel maybe not as happy, maybe more blunt. And so that also will impact stress because you're not feeling those highs and lows. So vitamin D is a vitamin I often ask my patients to get checked when we run blood work, so we're able to see and really identify where's true deficiencies versus where there's more symptomatic, and how I can dose it accordingly to what's left and what's deficient. So I really just want to leave you with a few kind of summary ideas, and that is that stress is systemic. It's not in your heart, and it's not in your lungs, and it's not in the way you tap your feet or in the inability to fall asleep. It affects your brain. It affects the way you think. It affects the way your body functions. And prolonged stress is not conducive to longevity. And so you need to identify where there's challenges and detour, reconfigure the path, and get on a better lane. And the calm is trainable. So it's not that, oh, she's so calm and I wish I was calm. It's a trained behavior. It's a skill. Through small daily activity, consistency, and discipline, you will see yourself in a different position if you start today. And you don't have to be perfect. One day you're doing breath work. One day you're having a cup of tea. One day you've walked for 10 minutes. One day you did a more intensive class. It's not about perfection. It's about consistency. And of course, nutrition matters. And we have to regulate in order to relax. And the only way to do that is really the awareness that we can't eliminate stress, right? Can't take that piece away. It's part of our everyday. But what we can do is reposition the way we see it and the perspective we have on it. And so I want to thank you all for your attention, and I'm hope for some engagement here. I know that Lisa is going to take that over. And if you do need to reach me or want to discuss anything, I have a QR code and I can just be, contacted that way. So thank you all very much. And I'm going to turn it over to Lisa.
Audrey, thank you so much. As we chatted at the beginning, this topic obviously touches so many people, and to have you be able to give us these insights is really important. And I think that everyone who's watching will agree with me that your ideas are really helpful and certainly things that we're all going to start to employ in our daily life. So thank you for your insight and your expertise. The questions are starting to flood in, so I will remind everyone, please put your questions in the Q&A and I will get to as many as I can. So there's a question about children and teens. Does regulating and calming yourself work the same way for children, preteens, and teenage girls?
I would say absolutely. I think the earlier you can help your children identify their thought patterns and processes and really position themselves in a state of control and learn behaviors that help to mitigate the eventual stress that leads to anxiety, because this is eventual. It doesn't get undone. And for us women, we have the added layering of hormonal volatility. And so through adolescence, girls are learning that their bodies are changing, and sometimes they feel even less in control, working its way through perimenopause and then eventually to menopause. So absolutely, regulation at any stage, and support is always available. And it's good that, moms or caregivers identify that, because often it will come up eventually. So better younger interventions for sure.
Right. Um, Question around the use of melatonin. Recommend it or don't recommend it?
Again, I can't speak to all of that. It's been studied best in like jet lag, and a lot of people do feel benefited by the melatonin. I will say that there's a huge range of dosing from 10 grams to 5 grams to 2 grams to slow release. I will say that in Europe, melatonin is a prescription, and just the fact that here it's so easily available, people are using it. But it's a hormone. It's a hormone. It's manipulative. The side effect profile, melatonin often can cause very vivid dreams, make you feel very drowsy in the morning. And so just be thoughtful of when you're taking it, how you're taking it. Is it slow release or not? Is it dose dependent on your size? And any other morning effects. I really like my patients to wake up. Their cortisol is what wakes them up, but then they get out of bed. The snooze thing, the scroll thing, that's not positively seen for me when I look at my patients, and often a big side effect when they take melatonin.
Good to know. Yeah, I have the weirdest dreams when I take
Right.
melatonin. Um, um, okay, question around supplements.
Yeah.
So you were talking about some of the supplements and nutrition. Where are some of them available? What do you recommend and interactions with medications, that
Okay.
sort of thing?
Good question. As a naturopathic doctor, as a regulated healthcare provider, I need to be aware of all drug and prescription drug and herb interactions. So I'm very mindful of taking a very complete history of my patients and understanding, where there might be a challenge for them. Most health food stores do carry a select amount of, I would say, good quality products. I'm mindful of drugstore versus health store. I'm even more so mindful about online, where there's less of a regulation. In Canada, everything needs something called an NPN number, so everything's regulated with a number. Not every country follows suit. My personal kind of pet peeve is proprietary blends. When there's a concoction of multiple things and it's like, this is the proprietary blend of anxiolytic herbs. How much is in it? Where is it cultivated? What is going on here? All my patients know this. If Audrey recommends it, It's because it's a deficiency. There's a deficiency in the grand scheme of their nutritional profile. And so you use a supplement to supplement. It's not in place of, it's not to exaggerate. And so I'm really always focused on therapeutic dosing. And so it's not about taking fish oils, it's taking the right amount. It's not about taking vitamin D, it's about the right amount. And so if you're missing the dose, you're missing the
The
absorption,
benefit.
you're missing the
Right.
benefit.
Exactly.
Yeah.
Yeah. And also you mentioned magnesium.
Yeah.
Magnesium's hard on the stomach. So is there
Not
types
Yeah,
of
there are multiple.
magnesium?
Yeah, so there's multiple types of magnesium. Magnesium citrate, for example. So the conjugate is where you can manipulate where it's going to land. So the citrate is more notable for inducing bowel movements versus a glycinate or a bisglycinate, which tends to do with more of that relaxation, calming effect, versus an oxide, which is way more of a like emptying piece. And so we position what we need. If it's constipation, if it's musculature tension, or if it's inability to fall asleep and have it more restorative. Across the board, I found women to be very low in magnesium. It's an often more challenging mineral to get from food. And suggesting for women to eating like cups full of almonds or cashews or chia seeds or having these green leaves daily and at therapeutic order tends to be more challenging. So it typically is one that I do offer or suggest for patients to supplement just so they can see the benefits of that. And of course, women, bone density, osteoporosis, and that level of support. So it is definitely on the radar.
Great. Good to know. Thank you. Um, Flight or fight? What about freeze? Where does that fall
So
into
that's in that
this?
decision-making piece where I spoke about that's fatigue, that burnout. That's almost the overextension of the fight or flight. So when you still have that fighting power in you and you get excited and you're okay to work through it, but you know you're not yourself. And then when you over cross that mark where you're just there, you're just, helping your kids with homework, but you're at the dinner table, but you're not really engaged. You went to an event, but you really weren't present, or you're just burnt out. You're removed. That piece requires recovery. That's where I spoke about a few supplements that are more restorative. So they're not meant to supplement the bridge. They're meant to really deeply help rebuild that adrenal support. And those mechanisms do require support and happens in many different ways. But we need to be mindful of that. And so once you can identify, I need this, these are the strategies. Are there interactions? Yes or no? Did we do the blood work? Yes or no? Did we see family history? Is there something in your medical history? Are there areas of weakness that we can help support through prevention? So naturopathic medicine is really positioned in like chronic disease management and preventative medicine. So if you're bleeding and you need stitches, I'm not the one. But if you're on diabetic medication or blood pressure medication and you're looking to help support it through different lifestyle measures, then I'm definitely able to support you. If you know that every winter you get sick, then I'm definitely able to support you. So it's identifying the gaps and building you up so that you're positioned in the most optimized way.
Okay. Question around stress and how it affects conception.
100% it affects conception. I do a lot of fertility medicine.
Okay.
Yeah, I think it's a very, very clear. And anyone who doesn't explore that is missing a big piece of the puzzle because the mind is very strong. And when we are coming into a very nourishing time in our life, and the expectation, especially with fertility, when there is so much disappointment and not a lot of support and that anticipation every month, and that letdown, it's a very hard emotional journey. And it's seen on a very physical, like how many eggs is the follicle? Did it mature? Is she, ovulating? What's the sperm count? It's very mechanical. But in
Mhm.
fact, it is so much more than that. And 100% stress management has to be addressed with fertility.
I guess that can explain why often couples who have been struggling for years to conceive and then they decide, they're not going to go through with any more rounds of IVF, and then all of a sudden you find out they're pregnant naturally,
Absolutely. Or they go on vacation and it just happened, or they had a
right.
drink of like, absolutely. The mind is super strong and that's what I kind of want to drive home. It can be rewired. You're not in this kind of default, I'll just follow the path of least resistance. Go, make a path, reposition.
Um, so when, stress is actually physical, what do you suggest or advise I don't really actually understand this question. Um, when stress is actually physical, stenosis, for example, what do you suggest or advise? That's the question.
Like your heart's racing and
I
you're
guess,
sweating.
yeah. Or
Yeah, I
think
mean,
constriction.
where's that constrictive feel? So sometimes stress is really panic, and there really is a panic that's associated with it. And so it needs to be addressed. And while, I can tell you to stop and breathe or, start touching the ground with your feet, these are
Hmm.
patterns that are more have the longevity to it. In those cases, I really do use nutraceuticals or like vitamins and supplements that I can really anchor and position. And so it's all about setting a foundational groundwork. So I always talk about, base zero, right? When you come to see me and you've exercised and I eat gluten free and dairy free and da 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 da. I'm like, okay, so that's how you came to me and you still feel this way. So that means we need to do something different. So we have to understand when that person is saying that they're feeling panic and stricture. And yes, of course, you can box breathe and you can, use lavender and take magnesium and do all these different things. I really would prefer to identify where that's coming from because as a naturopath, I like to understand where the root cause of all of this is so we can reposition that and have or create different relations around that trigger. That would be ideal because I don't like symptom treating. I like root cause. And,
Sure.
and around that piece as well is leaning in probably on some supplementation to help lower the threshold, relax the body, and then build into that recovery piece.
Right. Let's talk about chronic pain and how
Okay,
it impedes sleep.
sure.
Any advice?
So
And there
pain,
was a question around CBD oil. Thoughts on that?
okay, so in terms of sleep and inflammation, so and I always say inflammation and pain are the same, right? If someone's telling me they're in pain, there's inflammation, there's pressure. And inflammation will be a state of acute stress, and healing can't happen in a state of inflammation. So we explore different natural anti-inflammatories to decrease that level of inflammation, and often stress will exacerbate pain. Have you ever seen someone who's in pain and then they're stressed about the pain? That pain is amplified versus if their nervous system is more calm, and then that pain doesn't feel as apparent or as shooting or as loud or as alarming. So it is multimodal. And I wouldn't say that anyone who has sleep issues is exclusively going to seek the help of just sleep. We're looking at what's influencing the sleep. Is it hormonal? Is it inflammatory? Is it diet related? Is it reflux related? Is it habitual behaviors on your sleep hygiene before bed? Are you decompressing? What's your social engagement like? What's the relationship with the person you're sleeping next to? Like all of these things are really part of the story. And that's why I always say this like classic line, I don't have handouts. I don't have the sleep handout, don't have the constipation handout because the reasons that these are happening for me or you or Mary are different. And so you can't say that everyone gets the same thing because the triggers are different.
Hmm.
And I'll go back to the CBD. I don't have much experience. I can't give it in Ontario. Um, some people find it to have a lot of relief. Some clinics, it's easier to find, I guess, for pain. In different provinces, there's a lot more leverage to that particular one, but I don't have too much data in my own practice for that.
Okay, so we only have time for another two questions.
Okay,
Let's talk about two together. So
sure.
one question was around meditation and
Yeah.
another question around mindfulness.
So I would say that meditation and prayer are very similar, and it brings you into mindfulness. Like if you're if you're at shul and you're praying, you're mindful. You're hopefully you're present enough to understand what you're doing. If you're meditating to a higher power, you're looking to channel a certain shift, right? If you're able to meditate, which I congratulate anyone for, because that also takes a lot of practice. I can close my eyes and, oh, I wish da 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 da, but really to get in that alpha wave state where the brain is calm enough to open and accept. And whether that's precipitated by deep breaths, by open palms, by diffusers in the air, by imagining yourself on the beach or in your happy place, all of these are visually appealing. And I think that the mindfulness really has to go with augmenting the visualization component. And once we're able to really get into that frame, that is the ultimate, right? Because you can quickly channel yourself and shift as one of the tactics in reforming, neural function and neuroplasticity is really reshifting, and that is through mindful. All of these things are mindful behaviors. The walking, the breathing, the exercise. You have to be present in order to engage in these behaviors. So I would say part and parcel, absolutely.
Okay, so last question for everyone who's listening. If they were just going to be able to implement one change
Mm.
tomorrow morning to better manage their stress and anxiety, what do you suggest?
I
One
hope I
thing.
drove it home. You're not checking your phone in the morning. You're waking up, staying in bed, you're going to breathe, you're going to reflect on what your intentions are for the day. I'm going to be a powerful woman. I'm going to achieve what I want. I'm going to get everything done. I'm going to do it with intention and focus. And these are the top 3 things that I'm going to do today after I brush my teeth. I'm going to prepare a healthy breakfast and not grab a coffee first thing in the morning to set up, you can, but you can drink water and you can have some protein. I'm going to have, some fiber, good, healthy, balanced breakfast. And then I can check my emails because I can guarantee you that anything requested from you at 7 a.m. will be okay to be responded to by 8 a.m. too.
And that's great advice for me. So I love that because I unfortunately open my phone first thing and then already start my day with a stomach in a knot and I'm stressed. So I really appreciate that
Breathe.
advice. That's excellent advice. And Audrey, thank you so much for joining us
My
today,
pleasure.
sharing your expertise. It was excellent, and there's so much takeaway value from your presentation. So thank you, Barb. Thank you so much for being available today to step in for Tova, who's on vacation.
Always my
Thank you.
pleasure.
Thank you very much. Just a couple of notes before everybody leaves. Just a reminder that tickets are available for She Day across the country. Learn how to be empowered, inspired. There's so many wonderful activities happening in Vancouver, Calgary, Edmonton, Montreal, Toronto, London, Ontario, and even in Delray, Florida. So available on our website at chw.ca. Just click on the homepage to our She Day page and please buy tickets for one of the centers near you. Our next webinar is taking place on March 24th at noon. It's sponsored by Israel Canada, our new national corporate partner, and we're going to learn about purchasing real estate in Israel for vacation properties, for investment properties, or to make aliyah in a 4-part webinar series from March through till June. So thank you everybody for joining us today. And we look forward to seeing you all soon. Thanks again, Audrey. Bye for now.
Everyone.
Bye bye.
Bye bye.